Hi, my name is Zorica Buser, and I'm coming from University of Southern California.
I'm Mark Erwin. I'm an assistant professor in divisions of neurological and orthopedic surgery for the University of Toronto. And we're here to talk about stem cells and disc disease, right?
So, very important topic.
Yeah, it's a very interesting one. It's one that's pretty controversial, wouldn't you agree?
Absolutely.
Yeah, there's a lot of talk about it. There's a number of commercialization attempts to do this. There's a lot of research looking at the area. And stem cells are a pretty sexy area, right? People think you could reclaim youth somehow by injecting these fascinating cells that could potentially, in a degenerative condition, whatever it might be, in this case, disc disease, I guess, maybe we could get them in there and they could rebuild the degenerative disc. Do you think that's what happens?
No, I don't think we have the evidence. Like, we have a lot of big words when it comes to stem cells and spine, because low back pain is such a huge issue and we all want to fix it fast. So stem cells sound very interesting, and I think for some people an easy way to fix the problem, but I think there is so much we don't know and so many gaps we still have to fill to even think about using stem cells.
Yeah, I think that's right. Go ahead.
No, a question I would have for you, do you think that the stem cells will work for disc?
Well, it's a good question. We've just gave a talk this morning about this, and we've injected stem cells in an animal model, and it does show a good cellularity. It got established in an animal model that we know it's a disc needle puncture injury model, and we know that the disc degenerates. But when you put stem cells in, there is an improvement. But how's it work? And how long-lasting might it be? And that's a small animal. What about humans?
Yep.
So I'm not aware, maybe there's something out there that I'm not aware of, perhaps you know, but I've never read anything convincing that we can detect what happens to stem cells after injection. And although some limited human trials are showing some benefit, but also human trials have shown injections of saline people do just as well. So that speaks to something that you were saying, I think, about how back pain is a complex problem and what's causing the pain, right? And so if the stem cells are injected into the disc or administered however they are, and they are able to, do they integrate into the tissue and survive long term? We've not seen that yet. We've seen beneficial effects conferred after the injection. My guess is that's probably associated with factors or molecules that stem cells secrete, because we know that they secrete growth factors and other cytokines, right? So my guess is that at this point, probably that's what happens. We struggle to find these cells, and most others do too, and a lot of people don't want to talk about that, because it's very, very desirable to think that they get in there and they integrate and they make new tissue. But what happens in the case of a very degenerative disc, where there's no viable cells left, or not many? If the disc recovers, how does that work?
Yeah.
Right? So I don't know, and I don't know the right candidate. My guess is, like any other potential biologic, it needs to be more of an upstream, earlier intervention, I think, before the horse has left the gate.
I 100% agree on that. And
the other question, I'd ask in this area, Zori, is that what's the best source of stem cell? Because we have bone marrow stem cells, we have adipose-derived stem cells, we have human embryonic stem cells, we have umbilical cord-derived stem cells, right? Hair follicle stem cells. Which is the best one?
Well, I think we don't have the evidence that stem cells really work for disc. And what's the best? I think we first, as you said, we have to understand the mechanism, what stem cells can do for disc. Can they truly regenerate the disc? And then understand what type of a stem cell can work within the disc, because we know disc has a very harsh environment and it doesn't have that many cells. So when someone injects millions and millions of cells, what does that mean? And what I think we have to do is we have to, in a way, do a better job of educating patients and just the whole, everyone actually, to understand what stem cells can and cannot do, and that we still have a lot to work on before we can make definitive statements.
Well, I think you're right. This is one of those areas where I think sometimes, It's a triumph of technology over reason. You know, it's easy to take what you might see preclinically or something and extrapolate that. There's also, you know, can be a bit of a push for commercialization. You know, in some areas, I know there are a lot of stem cell clinics around now. The FDA is getting much more rigorous on their claims, because a lot of them, I think, are maybe a little lacking in some of the important data. And what I can't quite get my head around is that, as to what your point was, that a disc is a very harsh environment, right? Low oxygen, low pH, it's immune privileged, and all that, all those aspects. So you take stem cells from bone marrow, which are highly perfused, vascularized. You know, it's a normoxic sort of environment, and those cells, we take them and stick them into this very harsh environment. Why would they survive? How would that work? Should we not consider maybe stem cells from a different niche that might be better enabled to survive in this otherwise inhospitable environment, or should we transplant them with some helpers? Like should they be transplanted maybe in the presence of some kind of factors that might enable them to work better or something? Should we prime the environment? And to your point also, if it's too degenerative, lack of appropriate receptor sites and viable cells, maybe it's just not going to work at all.
Yeah.
But I think the real goal here will be to get a better idea of to your point, what do they actually do if they get in there? How long do they survive? And what are the effects they confer upon resident cells? And how many? You mentioned like some, I know I've seen some studies where there's up to 23 million stem cells.
Yeah.
A human disc has about 800,000 to 1 million cells or so.
At most, of both types. Yeah.
So millions and millions of stem cells in there does not strike me as a reasonable thing to do, though maybe it's because they're trying to use these cells as growth factors, cytokine factories, and hoping they survive long enough to do something, right? So these are all the important questions I think need to be answered, right?
Yeah, and I think we really need the evidence and to have good working models so that we can.
Yeah, and that's the other thing. You know, it's easy for us, relatively easy. In animal models, we can look for mechanics and cell-based assays, but in a human, it comes down to how you feeling.
Yeah.
Right? So our outcome measures are difficult for human clinical trials. So I think that's also a big limiting factor. But it certainly is an interesting area, that's for sure. Yeah,
absolutely.
Yeah.
A lot still to learn.
Yeah, for sure.
Yeah.